Substance use disorder, or SUD, is diagnosed when someone continues using a substance even though it's causing significant problems within their life. There are 10 major substance categories, including alcohol, tobacco, cannabis, hallucinogens, inhalants, opioids, central nervous system or CNS depressants, and stimulants, which can be prescribed or street drugs. While all of these can be harmful when misused, substances like caffeine and nicotine are often less emphasized because other classes pose more immediate health risk. Alcohol and tobacco are the most commonly used substances. An important point is that SUD can affect anyone, as it does not discriminate against race, age, gender, or socioeconomic status. It's very common for individuals with mental health conditions to also experience a substance use disorder. This is referred to as a co-occurring disorder, or COD. People with CODs are more likely to use alcohol and other illicit substances. As a result, individuals with co-occurring mental health and substance use disorders tend to have a poor overall prognosis, lower treatment compliance, and greater disruptions in their occupational functioning. SUD subtypes are categorized by the drug category, whether the drug is prescribed or non-prescribed, and the age and gender of the user. According to Knowles 2025, SUDs are the leading health concern in the United States. Among people aged 12 and older, over 40 million experienced a substance use disorder within the past year. 28.3 million have been correlated with alcohol, and 18.4 million have been correlated with an illicit drug. The development of SUD is influenced by a combination of neurobiological, psychological, and environmental factors, such as inhibitory control, certain personality traits like sensation seeking, and peer or social influences. To receive a diagnosis, a person must show symptoms in 4 domains: impaired control, social impairment, risky use, and pharmacological criteria. Within these 4 domains, there are 11 symptoms. Based on the number of symptoms, the disorder is classified as mild, moderate, or severe. If a person demonstrates 2 to 3 symptoms, their SUD is mild. 4 to 5 symptoms mean that they have a moderate SUD, and if a person has 6 or more symptoms, this indicates that their SUD is severe. Opioids can either be prescribed or illegal substances. When they are prescribed, it is usually to manage acute or chronic pain. Opioids can be prescribed for less severe cases, such as a constant cough. Opioids often cause side effects such as euphoria, confusion, and drowsiness. Most individuals who consume opioids illegally are searching for that euphoric experience, which is the experience of being high. Because some people seek out those pleasurable effects, opioids are frequently misused, which can lead to opioid use disorder, or OUD. The real danger of consuming opioids comes when it is taken in high doses. Opioids can slow breathing so much that the brain doesn't get enough oxygen, which can result in a fatal overdose. In the United States, opioid overdose continues to be a major public health crisis, with approximately 87,000 overdose deaths reported last year. To be diagnosed with OUD, the individual must demonstrate at least 2 of the 11 symptoms within a 12-month period. When an individual quits using opioids, they may experience withdrawal symptoms such as cramps, chills, restlessness, nausea, insomnia, anxiety, and strong cravings. Opioid withdrawal is not life-threatening. Alcohol use disorder, or AUD, involves patterns of drinking that become excessive and begin to negatively affect the individual's mind and body. People with AUD often lose control over how much alcohol they consume. They may find it difficult to stop drinking even if they want to. They experience cravings and social withdrawal. They demonstrate high tolerance, and they have severe withdrawal symptoms when they are not drinking. As the body becomes used to having alcohol in the bloodstream, it starts to rely on it to function both physically and emotionally. When alcohol use suddenly stops, the body struggles to recalibrate, which leads to withdrawal. Symptoms of alcohol withdrawal can include sweating, shaking, anxiety, insomnia, and vomiting. In severe cases, alcohol withdrawal can be life-threatening. AUD also increases the risk of several serious outcomes, including depression, suicide, criminal behaviors, and traffic accidents. It's linked to a number of medical comorbidities, such as liver disease, cardiovascular problems, stomach ulcers, and alcohol-related brain damage. While there's no guaranteed way to prevent AUD, early detection is possible through screening tools, which can help individuals access treatment sooner. If an individual remains sober, their life expectancy can be increased by 15 years or more. When we talk about addiction, it's important to understand that it follows a predictable cycle with three main stages: intoxication, withdrawal, and cravings. These stages are driven by four key brain networks. First, we have the reward network, which becomes highly active during intoxication. This is where substances produce feelings of pleasure and motivation, reinforcing continued use. Next is the executive control network. When this network is impaired, individuals experience reduced self-regulation, poor decision-making, and increased impulsivity. These are factors that make risky behaviors and cravings much more likely. The salience and emotion network are also involved, and disruptions here contribute to co-occurring conditions such as anxiety, depression, and suicidal thoughts. Finally, the interoceptive and default mode networks affect a person's ability to engage in goal-directed behavior and maintain self-awareness. On top of these neurological changes, individuals often experience irritability, heightened stress, social withdrawal, low energy, and decreased self-esteem. Over time, these symptoms can contribute to major life disruptions, including housing instability, criminal behavior, incarceration, unemployment, and social isolation. The Coleman Evaluation of Living Skills, or the CELS, is a standardized assessment used to determine how well an individual can manage basic everyday living tasks. The CELS looks at several broader domains such as activities and participation, cognition, communication, and mental functions. However, it primarily focuses on 5 key areas: self-care, safety and health, money management, community mobility and telephone use, and work and leisure. Across these areas, the evaluator assesses 17 specific skills. The CELS gathers information through observation and interviews. Each skill is scored as either independent, needs assistance, or not applicable. An independent earns 0 points, while needs assistant earns 1 point. However, in the work and leisure category, needs assistant is scored as half a point. When all these skills are scored, the total can range from 0 to 17. A score between 0 and 5.5 suggests that the person is able to live independently, while a score of 6 or higher indicates that the individual will likely need some level of assistance to safely live in the community. Many of the common symptoms associated with substance use disorder, such as poor self-regulation, reduced self-awareness, impaired decision-making, deficits in executive functioning, impulsivity, depression, and low motivation, directly impact the skills required for independent living. These challenges show up across every area that the CELS evaluates. For example, an individual may struggle with self-care because they lack motivation or have difficulty maintaining routines. Safety and health can be compromised due to impaired judgment or slowed problem solving. Money management may be affected by impulsivity or cognitive deficits, and areas like community mobility, employment, and leisure often suffer when someone has low energy, poor planning abilities, or difficulty organizing their daily lives. By administering the CELS, the occupational therapist gains a clear picture of how substance use disorder is affecting the client's functional performance. It allows them to pinpoint which skills are compromised, determine how independently the person is functioning, identify where support is needed, guide goal setting, and develop targeted interventions that directly support improving the individual's occupational performance and independent living. The process of cognitive behavioral therapy, or CBT, is typically 5 60-minute sessions that move through 5 main stages. The first stage is an initial assessment. Next is identifying negative emotions and beliefs that urge individuals to continue using substances. Developing strategies to address the negative emotions and beliefs is the third stage. During this, the therapist teaches the client how to replace negative emotions and beliefs with more positive ones. The fourth stage is implementing behavioral interventions such as relaxation techniques. And the last stage is the closing session to summarize everything learned in therapy. The sessions involve group therapy for improved social interaction skills through role-playing. CBT is one of the most effective evidence-based approaches for treating substance use disorders. CBT targets the connection between the person's thoughts, emotions, and behaviors through cognitive and behavioral techniques. It helps individuals recognize their unhealthy behaviors and learn how to change them to decrease their dependence on substances. During therapy, clients learn practical skills such as relaxation techniques, coping strategies, and cognitive restructuring to improve mood, reduce depressive symptoms, and strengthen their ability to problem solve and cope with triggers. Family involvement is also an important part of this approach. Including family members in sessions helps build understanding and ensures that the client has consistent support throughout the therapeutic process.